today we have the pleasure to welcome Priya to join us. Hello, Priya.
Hi.
Before we dig into your work experience, Priya, let's talk about your experience at Drew. Can you tell us, the very basic stuff, what your major was, why you came to Drew and that kind of stuff?
I came to Drew in my junior year. I was a transfer student, so I graduated from Community College of Morris, CCM, and I was interested in Drew because of the UN semester program. And even though I'm a psych major, I was really interested in where global mental health policy comes together. So I was interested in UN semester program. And during the time I was applying, CCM and Drew had this transfer agreement where they would give full scholarships for who completed their associate's degree at CCM transfer over to Drew. So I got that scholarship. So they was like, okay, I have to not go now. So I did a psych major here and an international relations minor, and I did end up doing the UN semester too. So, yep.
That's great. How was your UN semester experience?
Oh my God, I loved it. It's one of my favorite experiences at Drew. It was just really cool because we get to go to the area where the UN building is. We study our classes are right by there in a neighboring building, which is also technically a UN building too. And we were so knowledgeable about stuff, and we had speakers who worked in all these amazing agencies. So it was really fun. It kind of the project I did ended up being the reason where I ended up going for grad school.
Mm.
It had a huge influence on what I did after graduation.
Right. I'm glad you brought up grad school and what you were working, where you're working right now. So tell us about, in your junior year or senior year, how did you plan for your future? How did you decide, oh, let me work for a little bit first and then go to grad school or go to grad school directly? How did you make that decision?
I think the main issue is that I wasn't sure what I actually wanted to do because I got into the psych degree being I would end up being a counselor, but it was not kind of where my heart laid or whatever. And so I just I loved mental health policy and all that stuff. So just being more figuring out how to make it work, how to set it up and everything without doing the client contact, which is nice, but which was not my passion. So I just wanted to take my time to figure out if that's actually what I wanted to do, because going into grad school, I was afraid I would take on this debt and then realize I do not like it as much. And because of how much I paid into it, I would just be pressured to get through with it.
Mm-hmm.
Yeah. So, and I also because of that, I kind of ended up procrastinating about the whole process and took my GREs kind of late. So it ended up being last minute I had to apply to schools, and it just felt like my heart was not in it. So I decided, okay, I'll just work in a mental health nonprofit for a year, which would be kind of it's still nonprofit work. I'll still get to have client interaction, and this would be my final decision on how I feel about this whole thing, and then also get exposure that I need and help me make my grad school decision.
Right. That's actually really good. So you're basically, yeah, I think a lot of the students who end up really liking their jobs in the end tell me that, you just have to follow where your heart, is, because otherwise you might not be very happy at your work, right? And then it's actually very impressive that you were basically considering both, right? You didn't just think, okay, it's too hard, because sometimes when you're at the decision making time, you're like, oh, let me just pick one because keeping two in my head is too much, right? So can you talk a little bit about your timeline? I know you said you were a little late to to take GRE and do that. So let's talk about, so when you first started at Drew, just walk us through. You had this idea of, oh, okay, I want to do public health, right? And then I want to be a counselor. So you said you wanted to be a counselor, but you realized, so just some milestone time stamps along the way.
Yeah, so I think the first semester was when I took my first time, like the first time, like junior year was the first time I took like actual international relation courses, which was like immigration policy and like just international relations. And
Mm,
that was when I was like, okay, this is like so much more interesting than my psych classes. And I love my psych classes, but it was just like the hard realization, like I'm enjoying this so much more. And I
mm,
was like, come spring, I was like, come like, I don't know, like spring I did my three classes, yeah, and then like next fall I was like set on doing the UN semester, so much so like I don't think I did any psych classes. I pushed all my psych requirements to the point I had to do 21 credits my last semester,
oh,
along with my honors thesis. My honors thesis didn't count into those 21 credits, so
wow.
I was like dead set on doing this like UN semester, and I did it. And like that paper, like I did it on like psychosocial services, like counseling stuff for refugees that
Mhm.
UN was doing, and it was like one of the hardest things I worked on, but then like it was also like it was the most fun thing I did. And like once that was done, I was like, come senior year, spring semester, like I was like, okay, that was the hard part because that's like fall semester. Then my like that was my fall semester senior year, and like spring came up. I had like just like this was around the times I'd taken my GREs and all that stuff, and it was coming to a time where I was like, okay, it's I have to start applying to schools. I'm kind of behind the curve, but then I was doing my capstones and all my classes, like classes, and I was taking my psych classes, and like I don't know, like I did my capstone. Like I had to do my psych capstone, and I made sure I did my most I could do to get like more international relations stuff with it. It's
Uh,
like about like psychosocial services, but all I did was talk about like how it's set up, how the politics, what it needs, like all public health stuff. And it was hard because that was around the time like I was working in for the econ department,
mhm.
like this project where kind of like it was a public health kind of study where like we were constantly talking with Lisa Jordan for training in GIS. So it was like more that was when I was like getting exposed to like public health as a major because I had no idea it was like junior year. I had no idea public health was a thing.
Ah,
I had no idea. So I just come in and I see Drew has this new major that I never paid attention to, or major minor, like something called public health, and I had no idea what it meant. I thought it meant like working like in the government and like doing
right, right, right.
kind of yeah. I just didn't think mental health kind of fit into public health or whatever, government work, not profit work.
Uh-huh.
So it's like I had no idea what it was, but I was kind of getting like like getting like more knowledge of it and everything. And I don't know, just like when I was researching for my like in fall when I was researching for my paper, I was getting more aware of it, and then just talking to the public health department and all, and I was like, okay, so this is actually a thing, and like they have
Mm,
like, mental health in it too, and like this is what I actually enjoy, like nonprofit stuff, health policy stuff, and all that. So it was like literally like around the time I was supposed to apply for schools, I'm like, oh, this is actually something I enjoy way more than like counseling stuff.
uh-huh, uh-huh.
It
Right.
was I was thinking a psych field, not even social work. I was thinking psych. So that meant I had to get my PhD before I could even like really do all the stuff I needed. So it was like I was setting myself for a long haul, not knowing if I would enjoy it. And then I was like, maybe public health is the way to go. Like, because I still get to help people, but I'm not in a position where I'm sitting like, face to face and having those like, like a classic therapist interaction. Because
Right,
as
right, right.
I feel like I would be doing so much better in like working around and setting those possibilities where people have access to those things as opposed to being the one giving those like directly out.
Right. So you really go ahead. Sorry.
No, so it was like still basically what I wanted for my life, but like how when I started school, that's basically what I wanted. But like now, it was going in through like a different way around it.
Right, right, right. Yeah, yeah, yeah. No, that was quite an exploration, right? You didn't know that thing existed, and then you fell in love, and you're like, oh, that might be something that I would really enjoy doing. And also, what I heard from what you were saying is, you started to see your role showing up in that whole industry, right? So before you're like, oh, maybe I am looking at the patient. What was the other side? patient and counselor, right, role, right? But then you realize, oh, I might fit better with the setup, policy, making that kind of role. So we see that involved. That's great. For students who are listening to this, that's absolutely really good. And also in terms of like lifestyle, right? Different jobs will have different lifestyles. So that's great. And then that actually segues perfectly into your work. So let's talk about your work experience, and then like what you learned from it, how you got, yeah, also how you got the job.
So like once I decided I wasn't going to go to school this year, like I needed more time to prepare and figure out my application, like my whole statement of purpose thing. So I had to like figure out the whole thing. But I it was like so like I was specific, right? Like I had to be like nonprofit, and like it had to be nonprofit, it had to be mental health work. That meant like I had to throw out a lot of like psych related stuff because you can only get OPT in psych, right? So it was
Mm-hmm.
hard being like, okay, no, I can just work at a nonprofit. It cannot be just a nonprofit. It had to be a mental health nonprofit for my OPT
Mm-hmm.
because it had to be related to my major. So uh, I think it was like tearing out stuff. Like I could not do HR anymore. Like I couldn't apply to HR jobs. I couldn't apply to like actual like I don't know, for profit places like mental health places were like bigger or whatever. Like there were some government jobs I considered, but like in the end, like I didn't go with them. So like another thing I realized was like it was only for a year. Like my degree was not STEM, so it was only for a year. So I was like, I can live anywhere for a while because I don't know where I'm going for grad school. So I eventually would be moving. So I let myself be open to that possibility that I'll end up working in the most random places that would need me more than like, say New York, where like everybody is clamoring to get the same job. Because I got like offers from New York, but they were like not as great as like I ended up in Minnesota, right? From New Jersey, I ended up in Minnesota. So it was not as like great offer, but it was like they needed me more over there than anywhere else. And I was like, that's like it's like 1 year I get to live in the Midwest. But I did do that. I applied everywhere, sent out applications. I just looked
Mm-hmm.
up like mental health nonprofits. And like I only had a bachelor's degree and like I had no client experience. So like it kind of set me back too, whereas like I was not as experienced as a lot of other people applying. So like having myself open to a lot of places like gave me like more options because apparently like there was a high need in Ohio for some reason. Minnesota has a really good like mental health like setup, nonprofit setup. So like it was like now it seems like such an obvious choice because earlier I was like, okay, it has to be New York or California, right? They
Right,
have
right,
the
right.
when it comes to it, but it's like Minnesota has such a well set up network. I had some in Chicago. I did have some in California, and like part of me was also like, okay, like I get to live in a very weird place. I have been to California. I've been to New York. I get to live in the Midwest. They were paying me more. Like sadly, there's a component where I was like, I get to save for my grad school, and like they were paying me more. That was interested me. I was like, I live by the Canadian border. I'll maybe get to visit Canada. It was just nice. Like it's like I have family on both sides. This is the first time I'll be living way away from family, and part of me was like, okay, that's nice. That's nice. Like nobody would be like, we're gonna come visit you. You're coming visit us this weekend, right? And it's like, no, I'm not. Um, yeah, they were responsive. I had like a lot of opportunities did go away from me because of my OPT. So like they were like I could only give them a commitment for a year, and like a lot of people were not looking for that. There were some research jobs that were like they required a 2 year commitment that I couldn't give, so like I automatically did not make it through. So like I think this was the most responsive in a way. Like they apparently had experience with it. Like they were like, yeah, we understand. They were very clear with the options. They were like, yeah, we are nonprofit, we can't do H1B, so like just so you know. They they were very accommodating because a lot of people either had no idea what OPT was
Uh-huh, uh-huh.
or like was like just like was not okay with me being for a year. So it was like there were not a lot of options by the end of it, and they were very accommodating about that fact. So I
Right.
did definitely end up going with like People Incorporated, which is a mental health nonprofit in Minnesota. It was like it's based in like there are multiple locations, but like my work site was based in St. Paul.
Uh-huh.
So I ended up picking them, and like once like I don't know, Max, if you remember like about like when I applied for my OPT, it got like delayed beyond my start date. So instead of starting in June, I had to like start in like late July. And like having those conversations every few weeks, being like, okay, it still hasn't come in yet, just so you guys know. They were like, oh, it's like, yeah, we're fine, like we'll wait for you. And I was like, this was really heartening to be like, there was a place that was like, yeah, take your time, just come in.
Right. Very late back. Yeah, I actually also started my OPT later, like 2 months actually later than the supposed start date. But like it was actually better for me because like there's this um, accidental 2 months of grace period. I was like,
I
oh,
know,
that's
yeah.
right.
I get to
That's so good.
only for 1 week, and like if I got my OPT on time, I would have been done by now. Like my
Yeah.
end date, technically, like actual end date had been like June 15th. So like I would have already been done, and now I have like another month to go, and it's like kind of nice.
Yeah, exactly. So on one hand, we want them to work very fast and then get us the EAD card. But on one hand, we're like, yeah, just take your time, no rush. But that's cool. So tell us about what you do at the nonprofit.
So it's like a mental health facility. So we work with a lot of people who have like a mental disorder, mental health disorder, and a substance use disorders. So we usually work with people who have like either come like right out of the hospital, like they were like acutely like sick and they just like got like stabilized. So now they're coming to a place where they can stabilize further before they can actually get into like regular housing or like even like a lower level of care. So usually we deal with people who have just had a suicide attempts, like have like being stabilized for 10 days or so, and like now they need help, like like being able to cope and like go back
Hmm.
to normal living. We have people who just like had like relapse or like use for the first time. We have people who like had TBIs and like related symptoms that were problematic. So a lot of issues, like we work with like a lot of homeless people. So a lot of stuff. So like it's just basically we have like help them with like coping skills, like connecting them community resources, like finding housing, financial stuff, and all, like getting like connected to a therapist, like making sure like otherwise their health is okay, like just like just basically all around like life stuff. Like basically when they walk out of there, do they have like a whole life that can like
Uh,
they living on with, like have everything set up for them.
right. So like preparing them to go
Yeah.
back, right, to the life. So what is your role then? Like, do you do all of that? Is it sort of like, yeah, go ahead.
No, it's like really depends because depends on like how much experience you have with like specific role you have. I am like the mental health rehab worker, which like in some states like is like the mental health tech.
Mm,
And basically I just do like more stuff, like I can't have like single client on client interactions unless until I have all my trainings in 2000 hours, and which like technically I don't have yet. So like so instead of direct client interventions, I have group interventions where like I maybe have like a support group stuff where I'm leading it, or like other like related like group interventions.
mm,
I
mm.
do a lot of like medication stuff, like just like medication administration, tracking medications, like just logging all of that stuff. I do some paperwork regarding that, like big paperwork regarding the whole housing stuff. I do try like some community resources and stuff. Like I'm more better at doing like LGBTQ like community resources like that, but like anything like that has to do with like government stuff, like government housing, like social security, disability stuff, I'm not as well trained in. But that's
Mm.
also a financial person deals with that. There's a housing navigator who deals with that. So yeah, mine is just like group interventions, medication administration, like some paperwork tracking, like the meds going in and out, and yeah, like sometimes I do client interventions and all that stuff.
I see. So, um, what what does your sort of lifestyle, work style look like? Is it 9 to 5, and then after like you get home, you don't really have to do a lot, or does work still come with you to home?
It's weird. I do pull overtime all the time because you're like when you're working, like our facility can accommodate 16 people at a time.
Mm-hmm.
It's like you come like you go in, so you have no idea, right? On one day it'll like be super chill and whatever, you get to do all your stuff. On other days, like it's like something has happened, someone is really struggling or whatever, and takes like hours out of your time. So you don't know going in like if you'll be like staying over or like
Mm-hmm.
whatever. Like it's like open 24 hours.
Yeah, yeah,
So it's like open every single day of the week. I have to work every single holiday unless I found someone to cover for me.
yeah.
So it's it's like in a sense like my work is done, right? Like once I leave that place, the people don't come home with me, right? So I don't have any like I don't do paperwork when I come home. Like I don't get like we are not allowed because of HIPAA. We're not allowed to bring paperwork home and finish it.
Right, 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 right.
So I do get to leave it sometimes behind, but like it is like a kind of a stressful job because you're dealing with people who are having like mental health crises or who just came like dealt with a huge one, and they are still kind of struggling. So it just like it's like making sure you come back and do your self care because sometimes I come back and I'm still worried about this person. I was like, I hope
Right,
they're fine. Would they be there when I go back? Like it's like what could I have done better in that situation? Like all these things come back with you. So like that's the hard part. But like otherwise, like I come home, I don't have to do any paperwork. I don't have to
right,
like answer any phones or whatever. I do have to stay sometimes a lot. I do tend to pick up some weekend shifts just for like making money for grad school, but otherwise, it's not like there is some like work life balance.
right, 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 right. And then how fast did you, because you went to a very stressful job, because helping others, especially helping others who need a lot of support, is stressful, right? Like you said. And then so right after college, even though you had a very intense last semester, but compared to work, that's still
Yeah.
like it's still very free, right? Like you can decide your time. So how much of a transition did it take you to like adjust yourself to like work mode?
Um, it was different because like you said, I'm so used to like having like a set schedule, like way I set it, right? It's like
Right,
I'm used to having like Thursdays off or like on Tuesdays, like I do like have two classes in the morning. I have the whole afternoon free, and like at 6 o'clock I go into another class. And it's like having like your friends nearby or whatever. Here it's like it was difficult at first because it's like I have to go in every day at the same time, and then it was hard because at some points like you have to be like, okay, I draw the line here now, I have to go home now, like I have to come back tomorrow at the same time, I can't keep doing this.
right,
like like you have to learn how to establish boundaries because it's not something like class where like professors like, oh, class is done, you can go. Here it's like there are multiple people who like have certain needs and whatever is happening, and it's like you want to stay involved because you want to help as much as you can, but it's like, okay, I have to draw the line. Like there were days I was there till 8 o'clock and I was like, I have to come back in 12 hours, this is not like helpful at all. So it's definitely like different, like just getting used to it, or like planning out even my groceries or everything because like just
right,
living by myself, there's no like cat like like easy food or whatever is here, or like I can't go home and like there's food there. So to plan out my groceries, I have to like plan out the stuff, I have to figure like plan out my rent. Is it take a while, but I did enjoy it, like just like being waking up like by myself and it's like time to go to work. It's like
right, right, right. Well, I'm glad you face it with such a good attitude. What's really funny is when I see students coming into our office, right? And then that's one of the things that I'm really very jealous is, they can come whenever they want. I'm like, I wish I can come in whenever I want to work. That'd be so cool. But, okay, so now you're talking about your work, and then um, tell us about your experience during the pandemic. I don't know because uh, I'm not very familiar with mental health and pandemic relationship, but I'm assuming that there might be like a change in your like the number of patients coming to your facility, or like people's have different issues, right? Because like a lot of people working from home, um they might have anxiety, and they might right be very stressed, and also so that's one part. And another part is really, how did you because you are working at a health facility, right? uh when there is a pandemic, right? And then so you're sort of like in a more dangerous, right, space. How did you deal with that, mentally?
Uh, it was interesting. Like it was definitely a weird space for all of us because we were like they designated us like essential health workers. So we were like, okay, this is like gonna change for everyone. It's gonna change most of our life, but apparently this is gonna stay the same. We're coming same day every day. And it was like weird because in Minnesota, like I don't know if you know, but like the cases are not as bad. Like it's not great either, but it wasn't as bad. So like everybody started working from home, school went online and everything, and there were less people out. But like much of the life for a lot of people didn't change, but we had to come to a realization that our lives were going to have to change a lot. I feel like I'm young and I'm healthy. Like there was a kind of a feeling like, oh no, it's like even if I get it, it's not as bad for me, which is like another thing in itself. But at that time, like when it first started, I didn't feel as worried about it. But then it was like I come into work and there are people who are immunocompromised, like who people who can get it and like they legit would die from it.
Right.
There were people who were like didn't have the amount of money they needed. Like it's like if they catch it, like now there are like lifelong implications of having COVID. Like they can't afford to have that in their lives, right? And it's just like certain type of responsibility you had where it's like even now when things open up, it's like I can't go out to a restaurant and eat even still, like even though everything is open, because I still have to come to work where there are people who are like way more vulnerable to this virus than I am. So at first it was like nobody knew how to kind of deal with it because like people were still coming and going, right? Like it's like we like hold people like in the place. They were still coming, they were still going, like the clients were coming in and they were going. So it was a hard place where like it's like where do we put the line, because there were so many people coming from the hospital, right, from like stepping from a hospital, and there were people who were going right back into there where like there was COVID. Like there were times where we were having people every day who had just been in the hospital who just got tested and they had to be here. And then there
Mm-hmm.
were people who really needed to be like in more like higher level of care, but they were like, just so you know, they might catch COVID if we send them there. And it's like, okay, like we are playing in very different levels right now. Where like where someone who doesn't need as much help is in the same place where someone needs a lot of help because of how many places became inaccessible at the same time. So it was we were like supposed to wear, like we started wearing masks all the time inside, but then like we didn't have enough masks to have
Mm.
people wear. And like it's a communal like place, like there are so many people there, and like we didn't have masks, so we had to like ask people to donate them, figure out ways to stitch them and all that stuff. And there was like clients who were like, for them, some of them had struggles because of like they might have respiratory problems, or they have like some mental health reasons why they were not comfortable like having a mask right on their faces. So having to deal with that, telling like while people are there, they're not like they could go out before, but when the pandemic came, like they were like, okay, nobody's going out until they absolutely need to. And that took a toll on a lot of clients. Like it's stressful for us, but we come in, we get to go home, and we come in and the clients are like stuck in this one place with like 15 other people and staff all the time. So
Right.
not only was like they had their own mental health system symptoms, now they had this added stress of being in the middle of a pandemic, stuck in a place with people, not
Right.
being able to go out. And like it was just like suddenly like everything that was going on just became like 5 times more stressful,
Mm-hmm.
everybody involved. And it was just like tiring to come into work because it's like you're worried about the pandemic, like you're worried about who's gonna like might be effective. You like you have people you want to help, but when they come in, you have like a suspicion on. It's like, okay, like, are they going to cough now? You're taking everybody's temperature. We still take temperature every single day. Every morning, I have the script memorized where I'm like, I go through a list of symptoms for everyone,
Okay.
and then I assess their temperature.
Wow.
And so it's like definitely changed for us so much, because even like now things are opening up, like we don't get to do a lot of things, our clients don't get to do a lot of those things, because when they come back into this place they have so much more worries about it. So it's like kind of like a harder place to work now, but like a lot of people just came together. We had to like figure out how we're going to do groups, how we're going to practice social distancing in a smaller place where everybody kind of lives together. So it was a lot of work and a lot of stress, but like we kind of made it work. It's like kind of, yeah, like we're kind of used to it now. It's like every day I'm like, okay, like I can read the script without even seeing anything. I can, everybody's know it's like Priya's gonna come with that thermometer at us, like where they will like come to me like I'm like, get ready for your meds, and they're like, just so you know, no symptoms, like just so you, like don't go through that script with us.
I see. I see. So it became the new norm now, right?
Yeah, it's like
Everybody.
some people automatically social distance, like without even realizing someone is in the room, they automatically move away without even like noticing.
Mm-hmm.
Weird.
That is very interesting. Yeah, it is definitely tough for you guys, especially like you need to limit yourselves to protect the clients, right? Like not to go to a lot of places, um, but I think this experience uh, would be an asset for you, right? Because without the pandemic, you wouldn't have experienced, 5 times more stress.
Great time
So,
for mental health. It's a great time for mental health.
right. So now we talked about your experience at Drew. We talked about your work experience, and we briefly also talked about how you, apply for your work. Can we dig more into that piece? So I guess my first question is, overall, how many like resumes do you think you submitted?
I have no, I sent so many. Like there were times where like I did those one click things that sent a lot of them together. Other times, like I applied like months on end for jobs. Like I don't even remember when I applied for the job I'm in right now. I don't remember applying for a job in Minnesota at all, but I ended up with it. So it's hard. Like it's like I applied so many places. Like just like I got like I got a lot of calls from Ohio. I was like, I don't remember applying to this place at all, because at some point it all blurred into one big thing.
Right.
And they would be like, "Oh, how did you hear about us?" And it's like, I don't remember ever hearing about you, but like, thank you for calling me back. I feel like it had been at least like 100. Like I have to like say like conservatively, because it's like because of the amount of times like the because I applied for months on end, right? So like
Right, right, right.
it has to be at least 100.
So, what was your strategy? And before that, I guess the important question is, uh, do the uh, positions that you were applying for, do they require cover letters or do they just want a resume?
Um, a lot of them did. Like a lot of them did require cover letters.
Okay. So then how do you, because that's a lot of work, right? That's even more work. So what was your strategy? Like, how did you um, change your resume and cover letter accordingly? Did you make up like your own template? And
Yeah. I mean, when I first started, I was like optimistic. I was like, okay, I'll do a personal cover letter for all of them just to know how much I like working with them. But I did eventually ended up with a template.
mm,
Uh, I think one of the first things I did was like, and I think that's like a lot of like normal like stuff they always try to tell you is that look for like how what language is used in the job description, being like, okay, we prefer these things, and like these are like words like the big words that we like or want. And it's like I made sure to mention that all in my cover letters. Like I made sure how much I'm passionate about mental health and stuff. Like I think there was like there was a certain period where I was applying for like mental health jobs in a certain like uh area, and all I did was like write the same cover letter but just change the name and address and send that out. And there was definitely like a template at some point, but I did try to like make sure it's kind of like set up. Resume I didn't worry about as much because like you're supposed to like customize it to the job you're applying to. But since I was kind of applying to the same kind of jobs, it didn't really matter how much I like worked it out. If
Right,
they were really interested, like if they worked more with like refugees as opposed to like local like populations or whatever, I would try to highlight my UN experience more, or like mental health policy more. But like otherwise, it was like the standard resume most of the time. The cover letters, like I did try to like research like companies more, like maybe go to their mission statement and be like, okay, what is that like they actually looking for?
right. But there's definitely a balance between the amount of work you put into one versus the quantity, right, of how many you send out. And then what would you say the return rate was for you? Like, do a lot of jobs call you for a phone interview, or not as many phone interviews, but once you get past phone interviews, a lot more ask you for like an on-site interview. So like how did that?
Yeah. I think when like early on, I did get a lot of calls, but like it didn't go um like some of them like would go well and they would call back, and then I would have to explain, like be like, just so you know, because I felt like it made sense to make clear about my OPT position, because once I was started filing paperwork with them, they would know right away.
Right.
And so it was like I didn't want to get to a problem where they just hired me and they're like, you're only here for a year. So I like when I was interviewing, I was just like making it clear like I'm on OPT, and a lot of them like had no idea what it was. It's like I was like, oh, it's like only for like a year, like whatever. So I like definitely after those first few calls when I explained them, like it's like I was like less likely to get a call back then, which could also be like I didn't make it through the first interview for other reasons too. But it was like at a certain point I was like I had like so many conversations being like, it's like, just so you know, I'm on OPT, and they're like, what is that?
Yeah,
Or
yeah,
like,
yeah, yeah.
so eventually I just started in my resume, I just put a line, or like in my cover letter I just started mentioning that OPT is a thing, just so you know, it's only for 1 year or whatever. If you're interested in H1B, I might consider it or whatever.
Uh-huh.
So like that definitely changed. I think later on it was like afterwards, like I didn't get as much callbacks, which could also like be different things or whatever, interview requests. But there were there was some, like I think for like every 20 applications I may have had like 3 or 4 calls.
Okay.
And
Well,
like I think only like, and of all the applications I applied, I had like what, like 7 or 8 job offers at the end of it. So it was like not the greatest response rate, like at least so.
I think it's definitely already very impressive. And especially in the beginning, you were like, you were making it very clear and educating people, like, hey, just so you know, this is LPT, right? I think this is actually really 7 or 8 offers. That's a lot. That's a lot. Even despite the fact that you put in a month, like if I put in a year, I wouldn't even get that many. So that's impressive. And then you talked about, putting UN semester in your resume and all that. What do you think helped you the most? Yeah, of course, you're not going to know 100%, right? Because you're not the employer.
Yeah.
But what do you think, if you are going to take an educated guess on your resume, that really made you stand out?
I really don't know. I think like what I feel like my current employees enjoyed was the breadth of experience that I had with all the random things I knew, not like I work in like I did the econ department, I worked in the music dance department, then I had like a random accounting experience, then like I had like my psych degree, but a lot of it was also international relations. I had like this like mental health policy like plan and all that stuff. So it was just like not an in-depth in a lot of things, but like there was just all these random things I knew. Like I was at one point I was like part of my interview was explaining them how I knew how to like work like this printer scanner machine that was like super complicated, and they was like, thank you, we've been like working on figuring that out thing for years, and it's like when I come in I'll take care of that. And it's like there were like these random little things that are like, okay, do you know, like, can you handle all these weird multiple things at once? Like, can you do group interventions, but also know how to like if like something happens in the like kitchen, can you like be like, okay, like I'll look at it or whatever, or like, you know, like someone is gonna like have this random problem where like it's like, oh, they need to find support groups for this one specific thing, like can you look it up? It's
Right.
just open to like doing more things than just like doing like counseling directly, because for people mental health is not just like what is in their like just in their head, right? It's like things that are bothering them around their world, and how can we make sure the world around them like is like more supportive, and just like having that way like idea of like being able to work around those things, like random things you would have to figure out. Like someone is going to be like, okay, how do I like use this like EBT card I have? And I was like, what is an EBT card? But just being open to like helping figure that out.
Right,
So
right.
they did it like that.
I see, I see, I see. So not just like one specific experience, but they look at your resume sort of like they're mapping your skills, right? And then they're like, oh, the learning skills, fast learning skills, and then the diverse experience is what they're looking at. That's actually really good. And then so now we talked about all of those, right? Um, do you have any um, advice for students who are either like starting to think about job applications, or are in the process of looking for jobs or internships? Uh,
Mm-hmm.
like any advice on resume, right? And then after that, like the timing to start and things like that.
Yeah, I would say first of all, talk to your professors. So many of them, like it'll like just help you direct a little bit. Like they'll give you ideas you haven't even thought of. Like just like as many professors as you can. Like nag them as much as you can. Like it's like they're your professors. They should care about this. So, like it's like the number of times like it's like how much I've nagged them. It was like I wonder if public health is the way, and they had to sit through the whole same conversation again for the seventh time. So definitely just like reach out to the professors, like have this conversation, talk about your future, just them being like, okay, so like seems like you're not enjoying this. Have you thought about this? Or like maybe like I know this person, they like might have this internship, because it's also a great way to like be like, okay, like do you have any resources that I can like figure out for jobs or internships? Um, Definitely utilize the career services, and like it's like a very like common thing, like the like cliche thing to say, but like don't be afraid to sell yourself, like even the littlest thing, like
Mm-hmm.
it's like as much as you think it's like, okay, like this is like whatever, but like just sell it, okay? It's like it's an experience, and like if you don't think it's important, like why would anybody else think it's important either? So definitely try to sell all, mention the little things, like try to use the language that like you see in their job descriptions. Do definitely write a cover letter. People like don't like really care for your resumes if they don't have a cover letter,
Mm-hmm.
but like also try to like add something to it. Like try to keep it to one page, but like still like they see cover letters, hundreds of cover. Some people like places see hundreds of cover letters every day. Like try to do something that kind of stands out. Like don't try like if they give you a template, don't stick to that. Try to create your own that like is like kind of different. You'll have to like apply to a lot of jobs. I know, like we when I graduated, we had TrueLink. Is that still a thing, or did you guys switch to Handshake or something?
A handshake, yeah. No.
Definitely realize that.
Okay, okay, okay. That's a very good advice. Um, and then you were also involved a lot on campus too, right? You were working on different projects. Your work, working, right, on campus, and you were like in different like student leadership positions. Um, so I guess my last question, which I think is very important for students to know, is that uh, think about your the percentage of time that you spend um, in class doing homework. That's one chunk, right? To all the other things you do to enrich yourselves, and then the time that you're just basically socializing, having fun. Like, what do you think the percentages are?
Um, as you know, I was in a unique position my senior year where I took 21 credits and it was still separate from my thesis. But I think like 70% have been like my studies, but most of it had been my honors thesis. It's just like took a lot of time out of my life, and it was like I was like very like it's like I'm gonna have to like the hardest like readers for this thesis. This thesis is gonna be all pristine and amazing. So like, which was like in senior year, like last semester was just like the worst thing I did. Like I felt like this was the worst decision ever because it's like they always came back right away. They were like, here's what to work on. And it's like, no, I'm so tired.
Right.
But like 70% had been studies. I think I spent like 15% on socializing because it was my last semester, and I was like, I don't know when I'm gonna see you guys because I was thinking about moving anywhere basically in the country.
Uh-huh.
I was like, okay, like I want to spend some time socializing. I was kind of like an introvert most of the year. I did spend like 15% like on like school, like the around the campus like stuff, like ISA stuff, like International Student Association, the ambassador stuff, and all that stuff. um it was like less like last semester. It kind of like I kept it more on the down low. Usually it would be much higher come other years because I did the student like international student ambassador. Then
Right.
I had ISA thing and like all
So
the
in
other.
those normal years, would you think the percentage would be then?
Oh, it would definitely be like 50% studying, like 15% socializing, and the rest would be just like other campus stuff.
Okay, 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 okay. And then that starts when you start being a college student, right? And then until you have like some semesters where it's just a lot of work, then you add schoolwork. That's really good. I was laughing when you were saying like it was super stressful, and then like they always come like right away.
Yeah,
That's so.
I
Uh,
see an email. I was like, oh no, I'm not gonna open this today. No.
right, yeah, but at the same time, it also I think it also really says that you do have a really tight connection with, and you communicate with the professors all the time, right? Because otherwise, it might not come so fast, right? But if you are really engaged in conversation with professors, they want to see your work and they want to give you feedback right away, and they will give you a lot of great feedback. Right? I remember you coming to our second floor conference room. Do you remember that? Like you were like just it was all over the board. I was like, wow, Priya's having a stressful time. That was pretty funny. But okay, so that's actually really good. We talked about your career experience, talked about how you applied for a job, and also dug quite a lot into your job experience. So do you have any final advice for students, Drew students?
Oh yes, it's like if you guys are going for your OPT and like you guys are like people of color, like women or whatever, just like it doesn't matter how like you feel like it's a basic or like starting position it is, just negotiate it for a higher pay because you guys are definitely worth it. And like something like once I start my job, I'm always like, I should have negotiated for more. This definitely qualifies for more. So like don't be afraid to ask for it because like just like sadly it's a reality that in your position you might be offered way less than like your other like white like male counterparts. So like just go for it. I say try like I said, try to sell yourself and you're definitely worth more.
That is absolutely a very, very good advice. And I think it's also like very important for students to know, right? Because like you said, they might uh, get out of school and not know whether they can,
Mm.
right? So when somebody tells them, yes, you can, it's very powerful. So, but thank you so much. This has been absolutely an amazing chat with you, and I'm sure I learned a lot. So I'm sure our students also learned a lot. So, and I'll post your LinkedIn on our website as well. So if students want to connect with you, they will. But thank you again so much. Really appreciate you joining us.
It was really nice talking to you, Max.
Yes, have a great rest of your work time, and best of luck with your grad schoolwork.
Yeah, thank you so
All right.
much.
All right. Bye.
Mm.